you very much, Dr. Ahmad. Ladies and gentlemen, you're welcome to this HN Fireside Chat. It has been an interesting year. Blessings from maybe the corona epidemic, but at least it has enabled us to attend so many meetings, such meetings. And it's my pleasure this evening to introduce the speaker for today, well known in Tanzania and also outside Tanzania. Is Dr. Paschal Ruggajo, who has many qualifications. He's an head of Department of Nephrology at Muhimbili University of Health and Allied Sciences. He's also a consultant nephrologist at Muhimbili National Hospital, and also a consultant nephrologist in the same area of MUHAS, Academic Medical Center, and also wears the hat of being a vice president of the Nephrology Society of Tanzania. He has got many qualifications. His CV is very impressive. He has done a lot of research, currently focusing on the linkages between underweight and chronic kidney disease, and also he has got research in HIV and chronic kidney disease. Being a man of vast experience and wearing many hats, he's going to talk about his journey as a clinician, as a teacher, as a researcher, as an administrator, and as a mentor in the field of medicine. And it would be interesting to hear his journey and learn a lot from him with all this good experience that he has had. And it's my pleasure to welcome you, Dr. Ruggajo, to co-progress.
Thank you so much, Chairperson. I hope I'm audible enough.
Yes, you are.
Yeah, thank you so much for your kind introduction. And thank you, Nikki. Thank you, Lloyd. Thank you, Amal. Thank you, Makwabe. And thanks to all the audience who have been waiting eagerly to hear my journey. Apologies for the technological hiccup, but I think we are home and dry now. So I was given a humbling opportunity of presenting my journey. And I was told, because we are in Christmas mood, we should try to make it as humanistic as possible and take pictures, insert stories to make it really a journey right from where I came from. So as humbly introduced, my name is Dr. Paschal Joseph Ruggajo. I was born in April 27 back in 1973, so I'm about to turn 48. And as many African families, I'm number 7th out of 12 siblings. I was born in a humble place called Shede, Mwanza South, Mwanza, Tanzania. And I just put a map there for those who are not coming from Mwanza, just to locate it in the general map of Tanzania. So my father was Mr. Joseph Ruggajo, who was a Marine officer. He passed away back in 2004, rest in peace. And my mom is Mrs. Veronica Rubea, who was a homemaker entrepreneur, and she's alive and kicking and in good health. Roman Catholic in my faith, baptized in 1981 and confirmed in 1982 in my hometown of Mwanza. So as I said, I was allowed to brag a bit and put a lot of text and pictures for family. So I'm married to Dr. Harriet Sistia back in 2008 in Dar es Salaam. She's known to probably most of you. She's a pediatrician and nephrologist as well. And we are blessed with children, Adriana, Karin, and Lorenzo. We live in Wazo Hill, and my hobbies include soccer, table tennis, swimming, track running, and classic music. As you can see, I've put some few pictures there from left to right with my wife, Dr. Harriet, with my 3 children there. And I was participating in one of the marathon just to underscore the truth that is my hobby. So I have had a long journey through the education career, probably just like anyone else. Back in my formative years in my hometown of Mwanza, I attended the elementary schools and secondary school between 1982 and 1992. And I was educated in modest public school system, Swahili medium. You start learning English from grade 3 Before that, probably you know nothing much. And then, yeah, you go through the ranks slowly, learning the language and learning materials as you grow by. So I attended my high school between 1993 and 1995, again in a public school in Ihungo, Bukoba, Northern West Tanzania, before I was selected to join Muhimbili University for MD degree. And this is our alma mater. Pretty much after that, my life, educational life has been in and around Muhimbili. And I've been even living in that area for the past 23 years. Just moved away June this year. So after completing my medical degree, I joined internship between the year 2003 and 2004 in Bugando Medical Center, which again is in Mwanza, no problem. And then I joined my medical registrar. This is a medical doctor in practice after you complete your internship in a humble Catholic hospital called the St. Gaspar Hospital, Itigi, Singida, which is right in the middle of Tanzania. And after that, a stint of 2 years, I joined my MMed residence back again in Muhimbili for 3 years when I graduated as a physician. And I was enrolled directly in a nephrology fellowship program. Back then, we had, I could say, lucky that the government of Norway, through its program called NOMA, had intended to train low-income countries' physicians to become super specialists, like in nephrology, cardiology, respiratory medicine, neurology, and such. So I was one of the very first beneficiaries to join into this program, which spanned into 4 semesters. The first semester in Tanzania, second semester in Norway, third semester in India, and again, the 4th semester, you come back again in Tanzania. The essence was that you go to Norway and learn the practice in countries where there are best resources. And then you go to India and learn how to improvise with limited resources. And then you accumulate all these experiences and bring home and try to make a difference in your own locality. So after that, I came back and started my practice as a nephrologist, as you'll see a little bit later. Before I was lucky enough to be selected in a PhD training program between the year 2013 and 2016. I had a training in the successful defense in the University of Bergen, Norway, under the tutorage of the late Professor Bjarne Iverson and Professor Egil Vikse, who is still tutoring there. So again, I came back, joined the ranks, and tried to teach practice and research, as you'll see a little bit later, before I was also drafted or enrolled for an NIH Fogart postdoc fellow at the T.H. Chan Harvard School of Public Health under the supervision of Professor Wafai Fauzi, probably known to most of you, in Boston, Massachusetts. And this is a fellowship program with research potential, which is ongoing. And my main focus in that is HIV nephropathy. So I put some pictures again, going clockwise for my secondary school and then my high school in the middle. There is a story behind this high school. Just a few years ago, it was completely destroyed by an earthquake. And this is how it looked then, but now it's a completely new campus. And I'm jokingly saying that it now looks so much better after the earthquake than it was. But that was a school which we are very proud of, and those were the formative years which made me get more and more interested to become a doctor. And then far right top, I joined Muhimbili University. This is a section in the library. As I said, after that I went to Norway. So left lower corner is the Haukeland University Hospital in Bergen. And in the middle is, again, the CMC Velol, the prestigious CMC Velol in Madras or Chennai in India. and now I'm enrolled in this Harvard T.H. Chan School of Public Health. I'm so grateful to these schools. They made me who I am today. Right away from learning the English phrases to become a competent nephrologist and a researcher who can influence others to become both researchers and clinicians. As I said, I went through some few hospitals. The top right corner upper is the Bugando Medical Center in Mwanza, which is the place where I spent my 1 year of internship. I learned a lot of skills there, which I came later to apply them at St. Gaspar Hospital, which is right top corner. This is the place where I was a general practitioner, being on call for 72 hours, all departments. So attending everything from a patient with an acute attack of bronchial asthma to a mama with obstructed labor. And you go around and around solving problems and giving care for 72 hours, only to be followed after a very few days, again with another round of call. So these places, I credit them for giving me a lot of hands-on, a lot of clinical leadership, a lot of ability to decide when you are in a team, and ability to decide when you are alone, ability to decide when you have people to look up forward to, and ability to guide when you have people who are looking up to you to help in clinical decisions. And the Muhimbili National Hospital is the place or a university hospital where we have trained and practiced. So after all these educations, I've been able to offer my little contribution to science. I, as introduced earlier, have keen interest in the so-called Barker's hypothesis, which is a developmental origin for health and diseases, trying to see the diseases which happen in adulthood, tracing them back before we were born, especially in utero. And I had keen interest in studying the adverse outcomes of fetal undernutrition, which are manifested by having low birth weight or being born small for gestational age or premature, and then epidemiologically following these people or populations for many years to come and see if they have increased the risk for one of these non-communicable diseases. In my case, it was looking at the relationship between low birth weight and being born with low nephron number, because this is what was predicted by Brenner in his hypothesis, and trying to see if epidemiologically this can be proven if we follow those who are born with birth weight, a normal one, and low birth weight after many years, to see who has a chance of or an increased risk of developing end-stage renal disease. The first contribution was to do a nationwide registry study, which was trying to compare again the familial factors, low birth weight, and development of end-stage renal disease. And I found a very strong association between surrogates of adverse intrauterine undernutrition and development of end-stage renal disease. This was an impactful study because it studied the entire Norwegian population, taking advantage of the presence of many comprehensive registries in the Scandinavia. So we were able to establish that those who were born with low birth weight had a 60 to 70 increased chance or likelihood of developing end-stage renal disease due to any cause in their lifetime. So we tested further this theory just to see whether it was vague on all cause of kidney diseases. What about if we tried to single out one particular disease and see if it holds water? So just to say, the first study was published in the American Journal of Kidney Disease, a very high impact journal, as you know. And the second study was, again, as I said, we tried to test our theory in a specific disease. And in this case, we tried to check if it holds when we follow up patients with IgA nephropathy. We did a retrospective study, and just to cut the details short, we established without doubt that end-stage renal disease due to IgA nephropathy was higher among patients or population who were born with small for gestational age, especially male gender. So this was again tested further for doing a glomerular histomorphometry, trying really to measure the glomeruli, because Brenner had suggested that if you're born with fewer glomeruli because of as surrogated by low birth weight, then the remaining glomeruli will try to compensate for the lost one by physiologically increasing the single nephron GFR, but by anatomically being transforming themselves to glomerulomegaly, just try to become big and compensate for the lost glomeruli. So we took the painstaking project of measuring probably close to 900 glomeruli using very meticulous technologies of measuring the diameter, the area, the volume of each of these molecules, each of these glomeruli. And then we found again that young male IgA nephropathy patients who had not developed end-stage renal disease, if you followed them by histological morphometry, you found that they had, those who were born with low birth weight and small for gestation age tended to have fewer but larger glomeruli, which was, again, as predicted, a compensatory mechanism to try and offset those lost nephrons. But counterproductively, this subjected them to developing end-stage renal disease earlier or an increase of that compared to those who were born with normal birth weight. So in my humble ways, I was able to use this technology, these registries, to establish or again to replicate what Brenner had predicted. So of course, these were my founding years in research. As we learn a little bit later, I've gone to do local and regional research, but it suffices now to say that I belong to different professional memberships. From the year 2011, I've been a member of the Medical Association of Tanzania, and I was honored to be given an opportunity to present the Ngirwamungu speech back in 2017. Ngirwamungu was the first president of Medical Association of Tanzania. So to honor him, we usually repeat, or at least give, someone is elected to give a speech in his honor. And in 2017, it was my lucky day because I was given that opportunity to present before the Honorable Vice President of Tanzania. So since 2012, I've been a founding member and Vice President of the Nephrology Society of Tanzania. And I've been giving annual presentations, scientific presentations in these NESOT conferences. And in 2012, I was again elected to be the NESOT representative, which puts all the NCD professional societies under one umbrella. So I am a representative in that. So in 2014, I was an affiliate member of ERA-ADTI. This is European Renal Association, European Dialysis and Transplant Association. And this was highlighted by my presentation in 2014 in Amsterdam in one of my PhD papers. Again, in 2015, I was an affiliate member of the American Society of Nephrology. This again was highlighted by my presentation in one of my PhD papers in San Diego, California, back in 2015. Again, in 2003 and in 2013 and 2017, I was able to send abstracts which were published in the abstract book of the World Conference of Nephrology 2013 Hong Kong and World Conference of Nephrology 2017 Mexico City. I had lucky to be a pioneer in the nephrology development in Tanzania, of course, along my colleagues as well. In 2009, I had a chance of being in the inception and inauguration of hemodialysis services at Muhimbili. In 2011, I was lucky to be the doctor in charge of connecting the first patient on the hemodialysis machine at Muhimbili. In 2012, I was again among the team which launched the kidney biopsy services at Muhimbili. 2012, I was again, as I said, a founding member in in forming the Nephrology Society of Tanzania. In 2014, I was part of the instrumental members of the scientific committee in setting the first World Kidney Day, but also the first NESOT AGM and scientific conference in Tanzania. Between 2015 and 2019, I've been in scientific committees for NESOT conferences across Tanzania. We have been so lucky to spread the nephrology practice and advocacy across Tanzania. We have strategically located nephrologists, but also we try to make sure that we do a lot of community involvement during the World Kidney Days and a lot of scientific involvement during the NESOT conferences, inviting both local, regional, and international delegates. And we are really proud of this feat. But again, in the year 2015 to 2019, I have overseen delivery of several renal services assets, including hemodialysis machine, kidney biopsy gears, ultrasound machines, etc., to Muhimbili National Hospital and Mnazi Mmoja Hospital in Zanzibar. In 2017, I had the opportunity of starting hemodialysis unit and renal services at MUHAS Academic Medical Center, which is also now called Muhimbili National Hospital Mloganzila campus. Again, in 2017, I was also involved in, again, initiation of dialysis services in Zanzibar, Mnazi Mmoja Hospital. And in 2017, I was selected to head the writing group for standard operating procedures and guidelines for renal services, which predated the inauguration or launching of the kidney transplant program in the same year. So if you look at this pioneering role, I thought that I was in a very vibrant and motivated team to be able to move from humble nephrology to kidney transplantation. So I have divided my routine roles into numbers. So my number one routine role is being a offering clinical care, being a doctor, physician, and nephrologist. And as you have heard from my story, I worked both as an intern doctor, medical registrar, and medical specialist and fellow, and as a consultant nephrologist in both national university hospital, and I'm also a visiting nephrologist in several private hospitals. So I have had a lot of lucky to have a chance to interact with patients and staff in both the government and in private cycles, and in the process be able to share my experience and guide proper treatment of kidney patients. And that is my most proudest role. My routine role number two is, again, being a clinical educator. From the year 2006 to date, since the days of my residency to now when I'm a senior lecturer at the most premier university of health in Tanzania, I have had the lucky of training literally over 1,000 medical doctors through delivering lectures, supervising seminars, and offering bedside teaching for internal medicine in general to nephrology in particular, to both undergraduate, graduate, and fellows. But since, again, 2011, when I became faculty, I have been able to train over 150 physicians, internists in general medicine, proudly to say, including Amar, who is here with us today. Again, since 2011 to date, since I became one of the pioneer nephrologists in Tanzania, I'm very proud to have trained and overseen the training of 19 nephrologists in Tanzania. Imagine this staggering number being achieved in 10 years in a low and now a middle income country. It needed a lot of dedication, a lot of motivation, a lot of mentoring, follow-up, supervising. And I'm very proud today that we have been able to train 19 nephrologists in Tanzania and 2 nephrologists from the East African region, one from Ethiopia and the other one from Uganda, Dr. Makanga. I hope probably he's among the midst of the audience today. So this was, again, through that cycle of getting a lot of support from our, what we can call founding fathers from Norway, and a lot of support from India, CMC Velol, where our fellows have had the chance of spending at least a semester there to learn where things are probably resourced better than us, and to learn where there is a lot of numbers and a lot of experience. And then later, bring this experience back home. And so far, the experience has really been very satisfactory. But in our department, we always also invite and train elective visiting students. And we have had lucky to train students across the globe, from the East African region, from Africa, from the European Union zone, from the US, Australia. They have all come in numbers to learn on tropical medicine and tropical nephrology. And I, for one, have had that lucky of interacting with all these. And they have had very good feedbacks on our training program in terms of rigorous, in terms of the scope of the cases we see, and in our teaching methodologies. My routine role number 3 is mentoring, supervision, and support. I would rather say perennially, I've been offering clinical, ethical, research, and career path mentoring to numerous medical students, young doctors, and residents and fellows. My role is also to ensure perpetual faculty succession plan, because even as a head of department, I do head across the span from young tutorial assistants in their 20s to professors in their 70s. So realizing the passage of time, I have the role of also trying to make sure that new and fresh blood and young minds come into the departments and raised through the ranks to become professors. So I do scouting, recruitment, and mentoring of suitable junior faculty, and making sure that I provide for them good learning and working and mentoring environment for them to excel as faculties. But I also support candidates to secure foreign clinical placement through our collaborators. So through ISN, we have sent several fellows in South Africa, in Norway, and in India. Through the Harvard School of Public Health, we have sent fellows and residents to learn. We have now a collaboration with Medical University of South Carolina. As I said, we still send fellows to CMC Velol, and we still send fellows at times to Auckland University Hospital in Bergen, Norway. So we are very grateful for the support we have from these partners, and the support and experience has been really bilaterally and mutually very satisfactory. So my routine role number 4 is research and publication, because I am a natural leader of the renal research group in our locality. Through this role, I've been able to support candidates, both undergraduate and postgraduates, to convert their research ideas into viable proposals. I guide candidates in selecting proper research methods, to chisel quality data collecting tools, assist in data analysis, and guide them towards dissertation write-ups. But I also guide candidates through the daunting process of manuscript writing. Everyone in his maiden manuscript writing, we usually approach it with trepidation. So you need support and experience. So I have been also honing my skills in guiding students into manuscript writing, and so far it is paying very much dividends. But I also encourage them to survive the rigorous review of peer reviews in reputable international journals, And recently we have started reaping results because increasingly students, especially residents, are able eventually to publish their work into international journals. This year in particular, we have had 2 candidates in my department who were able to break a record of having a publication in an international journal before graduation day. This is not a single effort. It is through the Renal Research Group, of which I should specifically mention that Dr. Francis Furia, my colleague, is working hand in hand with me to make sure that we really transform these, what I can call crude dissertation work into crisp manuscripts which survive the peer review and eventually end up in a publication. So I just hope one day he'll also have a chance like this to share his experience. But I also engage in the review process for several local, regional, and international journals. And for groundbreaking research output, I also guide candidates to produce policy briefs to relevant authorities, usually directed to the Ministry of Health. Some of these have been able to influence policy and change the practice of medicine in our locality. So this, again, is my routine role number 4. But as the heading say today, my routine role number 5 is administration. So I am the head of department since 2017. This actually makes me the CEO of the department. You have to act as the face of the department and the representative, or act as a bridge between the department staff and the university administration. So I do the core thing as a head of department is to make sure that the clinical, academic, research, and corporate leadership is in aligning with the university vision, mission, prospectus, guideline, almanac, budget limits, and strategic plan. So I swap my roles between being a clinician, a teacher, a researcher, and being an administrator, sometimes attending meetings and sometimes presenting in these meetings, and also being able to guide the staff under my portfolio just to make sure that they have a very good working environment. They are appraised from time to time. They are guided, they are supported. They are both supported socially, materially, and morally to shoulder this very difficult job of teaching and mentoring and supervising. So, but I also have to oversee the rational and optimal management of department resources. So we do have human resource teaching gears, just making sure that every time you have teaching spaces, teaching materials, timetables, everything coming out as it should be at the time when they should be, making sure that the smooth running of classes, of bedside teaching, of seminars, of grand round presentations, of journal club presentations are all timely and of value to both students and staff. So whenever you have a lot of people to lead, there must be things also to counteract. So as a head of department, I am also the chief conflict resolver, the chief disciplinary head, but I'm also, as I said, on the positive side, appraiser of the staff. So due to this experience that I've garnered, at times, from time to time, I also act as Dean of School of Medicine and other roles as assigned by my supervisors as well. So as you have seen, all this takes time, takes passion, takes a lot of commitment and a lot of sacrifice. But then we are living in a world where we have to produce the results. And you can't complain, someone has to do it, and you are lucky that it is you. So the reason I'm saying that I'm going to present in the next set of slides a few tangible outputs, because we have a lot of unseen, intangible outputs. Unfortunately, the world today is so much focused on printed work and publications, but there is little appraise to the activities or set of activities, which, if you ask me, are equally or even more meaningful, like the hours we spend teaching clinical students in bedside, guiding through their journal clubs, their grand rounds, teaching them to take a history, to examine patients, to put management plans, to follow up patients, to make sure that they know the patients right from when the patients come or admitted to when they are discharged. I wish there was a way that this intangible effort and input was also appreciated. But I'll go through a few slides here just to underscore the kind of work we have been doing here since we came from our training. So we have, again, published several work, both from us and from the students we have guided. And quickly, I'll just take you through some of these works without a lot of details. We have published in the Kidney International, the KI, on global collaboration bears fruit in Tanzania report. This essentially was a paper which showed how the training program, which was under the tripartite organization connecting Tanzania, India, and Norway, yielded a number of seed nephrologists who went back home to become nephrologists, to become academicians, to become research leaders, and to become administrators. It is available under the KI journals. You can just Google that or Google Scholar that, and it will give you an overview of how the seeding effort had borne a lot of fruits after that. The other publication from our group was Developing Nephrology Services in Low-Income Countries. Again, a case of Tanzania. If you read this, it will tell you what we have achieved so far since our humble beginnings in around the year 2010 to around 2019, where we have, again, put in focus all the clinical developments and achievements that we have achieved. And as you have seen, this was published in the BMC Nephrology, a very reputable journal. It can also be accessible if you can just Google Scholar that. But we also take a lot of pride, as I hinted, to the work that we supervised our residents working. Since we have started the practice, we have started auditing it. We have started just a rigorous review of what we do, and in order to improve the quality of what we do in day-to-day basis. We have had students selecting topics in nephrology and in general medicine, and then we guide them through the process, and they have yielded very good quality papers in reputable journals. So for example, this paper in Hindawi International Journal of Nephrology was on adequacy of hemodialysis and its associated factors among patients undergoing chronic hemodialysis in Dar es Salaam. This was under our student called Samina Somji. Now she's a leading, again, faculty in Aga Khan University. And to date, she still consults us. We do to and fro consultations when it comes to sharing academic experiences, but also research material. Yes, so we also have published on prolonged bleeding following removal of arteriovenous fistula needles after hemodialysis therapy in our hospital, Muhimbili National Hospital. Again, this actually was a clinical pharmacy student, Masters of Clinical Pharmacy student, and who was interested in that topic, and we have published it proudly in our local journal, Tanzania Medical Journal, and it is also up for those interested to just Google that and see. We are also proud of the interdepartmental kind of research. So these are just selected research. We have plenty of publications, but these are just selected for the essence of this talk. So sometimes we have students who are not nephrologists, but who are interested to do something which is related to renal insufficiency. For example, our student Mohammed Hussein have published a paper on prevalence and risk factors of acute kidney injury in polytrauma patients at Muhimbili Orthopedic Institute. So he's an orthopedic surgeon now. As a resident, he was interested to see how much burden of acute kidney injury is in polytrauma patients. And he found very interesting results, which you can find in African Journal of Emergency Medicine. Just Google that. Recently, we have also students under our supervision who has published on renal dysfunction among HIV-infected patients on antiretroviral. Again, very interesting results in International Journal of Nephrology. You can Google that. Again, this was one of the students who was able to publish before graduation. And this is just recent on prevalence of malnutrition inflammation complex syndrome among patients on maintenance hemodialysis at Muhimbili. So very good work, very resourceful. And I'm proud to say from his data set, there is potential, a number of papers also coming. So be on the lookout and we will share with them once they're out. In the list, again, which is also under review and probably to be published soon, is a paper on metabolic bone disease in chronic kidney disease, CKD-MBD, and its associated factors at Muhimbili National Hospital. The same study has also won a 10 million Tanzanian shillings CEDA grant. It is also in the process. I could go on and on and on showing my journey wearing multiple hats as the clinician, as a teacher, researcher, administration, and mentor. I'm just proud to say I could not do this alone. I say glory to Almighty God and utmost thanks to my family for support, my teachers, because as Newton said, we see further because we have stood on the shoulders of the giants. But also my colleagues in the clinical cycles, in the research cycles, in the faculty cycles, we do this work together. Alone, you cannot do this. But also special thanks to students and mentees who have been spellbound to follow instructions. And increasingly, we are finding students who are super motivated to go all the way and achieve feats which we are not achieved before. But on top of everything, we owe so much to our patients who have trusted us with their health. We provide to them quality clinical care. We have, as I said, in nephrology in particular, moved from general nephrology to kidney transplantation in only 10 years. A record, I think, in sub-Saharan Africa to be emulated. Without patients, we wouldn't be able to do this. So a lot of thanks to the patients who also happen to be chapters in our books, but also our everlasting teachers. So with this, I would say it was an honor to get this chance to present this topic. I thank AHN and all the organizers and all the participants who have taken time to listen to this journey of mine. I submit.
Wow. Thank you, Dr. Ruggajo. What an impact. It was a pleasure listening to you and
thank you.
Learning all these things that you have done, your journey. It is indeed an impressive journey. The themes that I'm getting from it is dedication to your work, dedication to sacrificing time to do all these things, to wear all these hats, perseverance, you can see. And I think a key cog in your journey as well is collaboration. I can see you've collaborated different places in this world with the different leaders. Maybe I can open the floor to any question. If you don't see any questions in the chat, whether there's anybody with a question, I can see many congratulatory messages and appreciative messages from different people. And many people have been inspired by what you've been doing. Thank you very much. Maybe any particular question from anybody in the audience? Perhaps an easy one, Dr. Ruggajo. being from Kenya, I'm not very conversant with the programs in Tanzania. The Norway program that enabled you to go and study in nephrology and go ahead to do your PhD, as well as the Harvard public health program. Is it still ongoing, and what collaboration led to such a program being put in Tanzania?
Oh, okay. Thank you so much, Prof. We still have a very healthy collaboration with both Norway and Harvard School of Public Health. But to give specific answers, for the Norwegian program, which intended to train SID, they call it SID nephrologists, who can go back and train others, was a limited project. It was only for 5 years. And I think 4 or 5 of us were trained during that time, including also one from Uganda and one from Ethiopia. After that 5 years, it was deemed that sufficient investment has already been made, and we were blessed to go ahead and do local training. So that program closed in terms of that capacity, but it has remained in terms of long-term collaboration, in terms of exchanging of clinical gears, in terms of just having short-time placements of fellows, and in terms of co-authorships of publications. As for the School of Public Health in Harvard, that has been a very, very long time collaboration, I think going back probably 30, 35 years. It is still very thriving, but it is also a little bit choosy because they kind of dictate which areas to be collaborating with. So there is so much interest in public health. So if you get a topic which kind of connect nephrology and public health, then they are willing to sponsor. And before me, there are so many beneficiaries, and I believe the doors are still open for those who have to come after me.
Thank you very much. Any question? Pascal, any comment?
Wonderful, Dr. Ruggajo. This is really very illuminating. You know, none of us really knew what is there unless we could actually listen to all this. So this is actually a wonderful session for juniors actually to emulate what you've been doing, and there's so many fronts, especially you see as a clinician, as a teacher, as a researcher, and researcher just not local. The collaborations that you're part about, you use those collaborations with both Vellore, the Harvard Public School, and Bergen to actually bring out beautiful publications, teach so many people as to how to write. You know, that has been wonderful, and so many intangible aspects as well. I think hats off to you for this wonderful work, and we're really lucky to have had you today to, you know, expose all this has been done and actually so much internalized and not been externalized. And I think the people today have been very, very lucky to listen to what can be done in the future. That's another very important thing. And the sky is the limit for the next generation, I think. And hats off to you for being a great leader of the next generation, a charismatic nephrologist, a clinician, an administrator, a teacher, a researcher. You know, that is fantastic. And I am sure a lot of the youngsters who have listened today would actually love to follow these footsteps. So thank you very, very much, Dr. Ruggajo, from my side. Thank you, and from AHN, Nick and myself. Thank you.
Thank you so much, Lloyd. Thank you so much. I am humbled.
Dr. Ruggajo, if I may.
Yes, please.
How do you make it look so effortless and stay so humble?
Well, thank you so much. As I said, first I say I glorify God for this, because it has to be driven by passion. You also have to have that act of wishing to work with young, vibrant minds, and then you don't frustrate them. Instead, you try to harness a lot of their energy and channel it into quality output. So I learned it from my teachers and I'm passing it towards the next generation. I've been lucky to be surrounded by a lot of supportive staff, a lot of colleagues. So part of it probably is natural, but most of it is through collaboration and through trusting that these young chaps are very intelligent. You just have to motivate them. You just have to guide them, and then they'll surprise you.
What are your future plans now, Dr. Ruggajo? Like in future, what do you envisage 5 years from now? What do you think you would achieve, or what do you think you would like to achieve 5 years from now?
Okay, so thank you so much. I do have my personal goals. In my personal frontiers, I think I'm looking forward to become a full-time professor. And through me, I would like to open doors, many doors for young undergraduates to become competent doctors, for residents to become competent clinicians and physicians, and for fellows. So if you ask me, in my clinical side is to consolidate becoming and learning, because the knowledge frontiers is always unfolding. So I'll try to keep my ears and my brain open to learn and become a good clinician, a better clinician every day. From my faculty position, I want to encourage and support and mentor and supervise a lot of students to become their clinical self competent practitioners. But those who have a knack for research, I want to open them doors and collaborations. Eventually, I want to learn from them. I want them to come through me, pass me, ahead of me, and then I start learning from them again. So the sky is the limit. And in terms of collaboration, we want to consolidate the collaborations that we have and open doors for more collaborations.
Wonderful, Dr. Jupiter, wonderful. Because as I see always, when a junior grows, you also grow. That's what you were. Thank you.
That's true. That's true.
Hello, my name is Dr. Makanga from Uganda. And I just want to say congratulations, Dr. Paschal. Dr. Paschal was my mentor, an excellent mentor, by the way. He not only taught me, but also invited me to his home and cooked for me. So I also found him in Norway, where he didn't not only mentored me at Muhimbili, but also in Norway. And I found it quite interesting because he was such an approachable man. I never had any problems with him. Yeah. Thank you so much, Dr. Paschal, and thank you for the talk.
Thank you so much, Makanga. You are my lifetime friend. Actually, I would say you are very intelligent. It was always easy to teach and mentor you. You are very motivated to become I think the sky only is the limit. I look forward to work with you through the East African platforms as much as possible. I know we still have a pending work between me and you in the diabetic thing, but let's keep the connections going. It was nice to see you in February before COVID hit in Entebbe. And I welcome you to join us again here as much as possible. Send your students to us, and we are going to send the students to you. Thank you, Makanga.
Thank you too. Thank you.
Yes, thank you.
I think I'll take this opportunity to thank you very much, Dr. Ruggajo, for all that inspiring that you've given to the audience, not only to the young colleagues, but for everybody. And I wish you God's grace and success in everything else that you're doing, that those doors that you're opening may really open for the rest of the young doctors in Tanzania wishing to become nephrologists, even beyond in East Africa and Africa and beyond. I think I'll hand over back to Dr. Lloyd Vincent for the conclusion of this program. Thank you very much.
Extremely grateful, Dr. Ruggajo, for this wonderful presentation. It is a huge inspiration for the juniors in the audience, and I'm sure this will go a long way. We also take your permission to make sure that this is put up on our site in the internet. This will be a video that will be there as part of the fireside chat. This is the third one that we've got. First one was Professor Brian Pereira from Boston. Second one was Dr. Vivekanand Jha, the current president of the ISN, and the third will be yours, Dr. Ruggajo. And yours speaks a lot about local reality, which is very, very important. And we take your permission to put up this video of this entire presentation up on the net. Thank you so much for spending time with us and educating us about all these things which we really didn't know at all. Thank you.
Thank you so much, Lloyd, and thank you so much, Mr. Chairperson, and all listeners. It has been really a pleasure. I would like to say Merry Christmas to all of you, and I say bye to you with this picture of mine in the midst of medical students, which was taken at the MUHAS Academic and Medical Center. This is what we do routinely, and this is what we should be doing, inspiring the next generation. So Merry Christmas to all of you. Looking forward to interact with you in the future. Thank you and bye-bye.
Thank you very much. Merry Christmas to all.
Merry Christmas.
Bye-bye.
Merry Christmas to you too.
Thank you for good